Many of my rheumatoid arthritis patients has asked me this hardest question. Does rheumatoid arthritis kill you? The truth may surprise you. Hi all RAers, I'm Dr. Ananta Subedi, co-founder of the Empower Arthritis and Rheumatology Center here in Katy, North Carolina, and your rheumatoid arthritis coach at the Room Doc. Before we start, please hit that like button, subscribe, and share this video. You never know who might need this message of hope today. Rheumatoid arthritis, or also known as RA, isn't just arthritis. It's an autoimmune disease, meaning your immune system, which normally protects you, attack your joints and sometimes other organs too. But here is the truth. RA itself does not kill you. No one dies just from the arthritis. Instead, it is the complications if RA isn't well controlled that can be life-threatening. The good news is, with the right treatment, lifestyle changes, and support, the risk goes way down. And that's why we are going to unpack this together. At the end, I have 3 important tips that you can use to minimize your risk of death from rheumatoid arthritis. Now, let's talk about the silent danger of inflammations. RAers, the danger isn't just the joint, it's the chronic inflammation. Think of inflammation as like a fire. If the fire is only in your joint, it hurts. But when that fire spreads to your heart, your lungs, or the blood vessels, that's when things can get truly dangerous. Now, if that fire attacks your heart and the blood vessels, that will increase your risk of heart diseases. And heart disease is the #1 cause of death in rheumatoid arthritis. People with rheumatoid arthritis are twice as likely to develop heart problems. That inflammation makes the arteries stiff and damaged, raising the risk of heart attacks and strokes. The next most important organ that rheumatoid arthritis could attack are the lungs. Lung disease like scarring or infection causes about 1 in 10 RA-related death. Hence, it's always important to monitor your lung-related symptoms such as shortness of breath, unexplained chronic cough, which could indicate lung inflammation. If that happens, you need to alert your rheumatologist or your primary care doctor for further testing. The third most important cause for death in rheumatoid arthritis is the weakened immune system. Because of the disease itself, when it is not well controlled, and sometimes the medications can make infection more dangerous. Hence, it's very important to take precautions, vaccination, and a close follow-up with your rheumatologist to monitor for any hiding infections. But remember, the risk is not the destiny. With the right care, with the right team you have, you can put out that fire, decreasing those 3 risks that increase your risk of death, including heart disease, lung disease, and the infections. Now, let me share a story of one of my patients. She's in her 50s, came to me with severe joint pain. Severe enough that she could barely open jars. But she did not just have rheumatoid arthritis in her joint. Her cholesterol level was high, her blood pressure was high, and she was in a lot of stress. When we did further testing, we also found signs of early heart disease linked to her uncontrolled rheumatoid arthritis inflammation. She was very scared, and she also asked me the same question that we discussed earlier. Doctor, is this RA going to kill me? I looked at her eyes and said, not if we can take better control of the rheumatoid arthritis now. We started on rheumatoid arthritis medication, which significantly helped her joints, but we also worked together on the NEST framework that included nutrition. She started on anti-inflammatory diet with more vegetables and omega-3 fatty acids. We work on an exercise routine. She started walking gently every day, even if it was just 10 minutes. She also worked on her sleep. She created a bedtime routine to help her get at least 7 to 8 hours of rest. And more importantly, we also work a stress reduction plan. She began journaling and doing breathing exercises, which significantly helped reduce her stress and manage her stress better. And I recently saw her for a follow-up visit. And to my surprise, her RA is under very good control. And even her risk of heart disease has significantly dropped with improved blood pressure, improved cholesterol, and level of stress has significantly come down. And she told me, I don't feel like RA is killing me anymore. I feel like I'm living again. Now, let's put some numbers to put this thing in perspective. Studies show that RA can shorten life expectancy by 2 to 10 years, mainly due to complications medications. But here is a hopeful part. With modern medicine and lifestyle changes, this gap is getting smaller every year. So there is always hope. Now these days, people who are diagnosed, we start treatment very early and stay consistent, often live near normal lifespan. But here's the better news. People diagnosed today with rheumatoid arthritis who start treatment early and stay consistent often live near normal lifespan. That's why early action is so critical in rheumatoid arthritis. Not just the joint damage, but also decreasing your risk of death. Now, here is a question for all of you RAers. When were you diagnosed and what has been the hardest part of managing rheumatoid arthritis so far? Comment below. I would love to hear your story so that we can share with other people who could benefit from your experience. Now, you might wonder these questions. Why things are improving as I just discussed? Why is the outlook better today than it was 20 years back in rheumatoid arthritis? Let me break it down. Number one, the medications. The biologics and the new medication like JAK inhibitors target inflammation more precisely than older drugs. Hence, we have better tools to control inflammation with minimal side effect. Number two, the need for early treatment or the awareness of early treatment. We now know that early treatment, early control of RA, the outcome is much better long term. And the third important is the idea of holistic care. Patients and doctors like us together are addressing not just the joint but the whole person. Other medical conditions, also called comorbidities, weight management, mental health, sleep, exercise, and developing good relationship with your family and friends. And let's not forget the 4F framework I call the fuel for stress management: faith, family, friends, and fulfillment. These aren't just extras, they are lifelines. They are the fuel for a fulfilling life. I have seen patients who lean on their community live longer, happier despite the diagnosis of rheumatoid arthritis. So always focus on your fuel, the 4Fs. So let me summarize what we discussed today. So RA itself does not directly kill you, but uncontrolled inflammation can lead to heart disease, lung problem, and increased risk of infection that can kill you. But here is the hope. Early treatment matters, lifestyle choices matter, and support system matters. And let me summarize the 3 important tools that you can use today to fight against the death from rheumatoid arthritis. Number 1, eat one anti-inflammatory food today, like salmon, walnuts, or leaf green vegetables. Number 2, move your body gently for at least start with 10 minutes a day. Walk, stretch, or yoga, or anything that you enjoy. Number 3, connect with your family and friends. Call or text one loved one because supports keep you strong and going. Now, all you RAers, please remember, you are not alone. Together, we can move from pain to possibilities. If you found this video helpful, please like, subscribe, and share with someone who might need some dose of hope today. And stay strong. Take care. I'll see you in the next video. Bye-bye.